Presiding Officer, the motion from Alec Cole-Hamilton says the hard-working staff do not have the resources and support they require to deliver the services they would wish. I beg to differ. I agree with Anna Sarwar, who said it is the patient that matters. So my entire speech is simply quotes from the Care Opinion website, all three cases from the last week covering all of Scotland. First, no. Aberdeen Royal Infirmary. I attended A&E during a mental health crisis. From the start, reception staff were really patient and understanding. I got seen in triage by Gail, and a man with me was just fantastic. She genuinely listened to me and didn't make me feel like I was a burden or anything. Due to the way I was feeling and the state I was in, I was kept in A&E to see the psychiatry team. In A&E, whilst I was waiting, another nurse, Bethan, was looking after me. I appreciated just the small things, giving me some juice and a biscuit, listening to what I had to say. I was in A&E for about 3 hours, and they didn't fix everything, but they gave me somewhere safe when my thoughts were too much, and I went with a plan. I can't really ask for more. I know a lot. We're going to hear from patients. We've heard from politicians. I know a lot about the A&E nurses from various admissions with self-harming, but Gail and Bethan did an absolutely amazing job when I needed it most, and a kiss then follows. At Crosshouse Pharmacy Services on Monday this week, my son has Asperger's syndrome and mental health issues. I'd appreciate some silence behind me, Convener. Presider. My son, it is dreadful that people have mental ill health, Mr. Rumbles. My son has Asperger's syndrome. And
it is getting a bit silly now. Would you please let Mr. Stevenson proceed?
My son has Asperger's syndrome and mental health issues. His medication leaked in his bag on Sunday. If he misses a dose of medicine, his mood can change considerably. It's normally a special order prescription. I rang my local pharmacy, who had none in stock. I phoned the pharmacy at Crosshouse Hospital and spoke to a very helpful pharmacist, Ailsa. She phoned round a number of community pharmacies and found one which had it in stock, making sure that I knew exactly where it was. I can't express strongly enough how grateful both my son and myself are for this excellent service. And from the south of Scotland last week, I suffer from... I will not be taking any from that source. I suffer from depression and anxiety, which can be pretty severe.
I think Mr. Stevenson has made it quite clear that he's not taking any interventions. So all this is doing is wasting time. Please carry on, Mr. Stevenson.
And which can be pretty severe. And suicidal thoughts and feelings which are present every single day and at times become overwhelming. What I would like to say about the crisis team is how I feel they are really in a league of their own when it comes to mental health services. It was during my first experience of using that health service, one nurse in particular said a few words to me in a moment of such mental and emotional pain, with such compassion and conviction that someone felt my life, me, had value, to know there was someone out there hoping for me because I couldn't. A nurse from the team would visit me every day for around the next 10 to 14 days. The crisis team are very special people. Yes, there are challenges in mental health. Of course there are. I have experienced suicide in my own family. I know that perfectly well. But there are good stories too. And let's not demean our staffs by pretending there aren't.